My name is Cynthia, but I go by Cyndi. Cynthia to me sounds so old, and I'm trying not to get older. I live with rheumatoid arthritis. I have congestive heart failure. I have what is called Hashimoto's thyroiditis, which is actually it's low thyroid's what it amounts to, but it's an autoimmune disorder. I also have Sjogren's. I have pulmonary hypertension. I have high blood pressure. I have pulmonary hypertension with the blood pressure. There's not many more body parts I have that's not. I developed POCS a long time ago. I've had a complete hysterectomy due to it. So it's been one thing after another. But the rheumatoid arthritis has really knocked me off my feet. I ended up having 3 heart attacks and a stroke, and that's why I had to give up I'm a retired nurse. I had to give up my nurse's career because of that. But the rheumatoid played a factor into it. I did not know, and I had been told years ago that I had asthma, but they really didn't think it was asthma. They'd say, oh, no, it's just because you're overweight. It's always this, or it's the pulmonary hypertension, it's congestive heart. Nobody ever pointed and said, you've got ILD. Nobody said that until about a year ago. I woke up one morning and I had a fever and I had a cough. So I went to the urgent care and they checked me out and they said, oh, you got a double ear infection. Take these antibiotics, you'll be fine. We'll give you steroids. I said, okay. So they gave me steroids. That was on a Saturday. That Wednesday, I finished the antibiotics because they put me on a med dose pack. I went to get an IV of Orencia, and I explained to them. I said, hey, I just finished antibiotics. And they're like, when's your last dose? And I said, my last dose was 2 days ago. They're like, oh, you're good, you're good, you're good. So I got my IV. That was on a Wednesday. Friday, I had been coughing still, and I took it all to double ear infection. It strains down the back of your throat. Your sinuses get irritated, the whole kit caboodle. Didn't think nothing about it. I got stood up to go put a blanket up because we were going to leave to go somewhere. And I passed out. I was in the hallway to put my blanket up and I just slid down the wall. And that was the last thing I remembered. I was totally black. I came to and my husband's looking at me, kind of shaking me. And he's, what's wrong? And I'm like, I don't know. Something's wrong. And he's, is it your heart? Do I need to call an ambulance? And I'm like, no, just get me out to the car. I said, I think it's just because the fever and all this. And he goes, okay. Barely could walk. He almost basically dragged me to the car. Yes, I should have called an ambulance, but nurses were like, oh no, we're going to live. Something. I get to the hospital. The triage nurse goes, honey, do you always have low blood pressure? And I'm like, no, something's wrong. I just don't feel right. And I'm coughing my head off and coughing my head off. And he goes, sweetheart, he said, we're not going to play no more. And he drags me they wheel me into the back. And the doctor comes running in there and he goes, do this and do that and do this. And I'm like, looking at him like, what the heck's going on? And the whole time I'm coughing my head off. Can't catch my breath. And they're throwing IVs on me. They're doing blood cultures. They're drawing bloods left and right. They're trying to ask me questions. And I could barely talk then. I could barely answer them because I had no breath in me. And they're shoving oxygen on me, PT, physical therapy's in there. They've got respiratory. I mean, they got anybody and everybody you can imagine in the ER in there with me. And I heard him say, her blood pressure is 94/49. And they're working me. And I kept coughing and kept coughing. And he's, we're going to give you something for your breathing. He said, I think that's your problem is you can't catch enough air. And I just shook my head. Yeah, that's fine. Because I couldn't talk by then. I was getting worse. So they brought in the respiratory therapist and they're doing breathing treatments and everything. And I'm still coughing. And he's, do you feel a little bit better? And I'm like, shaking my head, no. So they kept me in the ER for 7 hours. I didn't know at the time what they were up to. I thought you're trying to get you stable, trying to find you a hospital room because we live in a very rural area of South Carolina now. I'm used to Orlando, Florida. I can get taken care of, not up here. So this little community hospital, and they finally said, okay, we're going to transport out to Piedmont. And I heard the helicopter come in. I thought, no, that town's only 20 miles away. They're not going to air carry me. That's not me. That has somebody else that has to be. So finally they were back and forth. The doctor comes in. Now by this time I'm wringing wet sweat. My temperatures, I'm breathing just a teeny bit better because I've got 4 milliliters of oxygen going up my nose. They're giving me IVs. They're doing everything. And he says, we're going to admit you to the hospital. And I shake my head. Yes. That was the last thing I remember. They moved me into a room. That was it. I was gone. My husband said, it's like you just fell asleep, Cindy. The next morning I wake up and there's nobody in the room with me. This guy comes in, sits down, shuts the door, and he goes, I'm Dr. Crow. And he puts my hand in his hand. And I thought, well, that's strange. Doctors usually don't touch you when you're female and they're male. And he goes, sweetheart, he said, I want to tell you something. He said, you almost died on us yesterday. He said, you were actually in respiratory failure. He said, your kidneys were shutting down. He says, I refused to take your case. He said, I was the top ER doctor. He said, but you started turning around a little bit. He said, I told him, okay, we'll keep her and we'll see how she's doing in the morning. He said, if she's not no better, we are going to air care her out to Charleston, South Carolina, to the intensive care unit that is more advanced. And I looked at him, I said, am I okay now? And he said, you're going to have a rough week. He says, but we're going to see what we can do. And I'm like, okay. When I called the pulmonary doctor that I had just started seeing in the other town, because they're not all connected, the hospitals aren't. So I spent 7 days in the hospital. I was told I had double pneumonia. It was in kidney failure. I had gone into respiratory failure, the whole kit caboodle. I get out of the hospital, I'm on oxygen, 4 liters. They wouldn't even let me come home until they could get all the oxygen set up. That's how bad. I couldn't even get in room temperature. Room temperature, I dropped down to 79 and to lower 70s. So I'm like, okay. So I called I told my husband, I said, tomorrow we'll call the pulmonary doctor. I'm going to go see him ASAP. So I got in to see him. He ordered chest x-rays. He's what happened. I told him and I pulled up the records and everything. And he goes, I'm going to rule out double pneumonia versus reaction to the Orencia that you took. He said, versus lung disease. That's all he said. He didn't say anything else. And I said, okay. So I did all the testing. I did everything he wanted. This took about 2 months. Meanwhile, I went to see him. He goes, we need to get you off that oxygen if we can. He said, you're on high levels, 24 hours a day. He goes, I don't think if we don't get you, start working on getting you off this oxygen, we're never coming off of it. And it shocked me. And I looked at my husband and he didn't even know what was going on. He said, I want to do a complete CT scan and then I'm going to talk to you more about that and I get those test results. So I went and did a CT scan. I went back and seen him and he shut the door. And he never shuts the door when I go in his office. And I looked at my husband and I'm like, oh my God. And he's like, I ruled out you don't have cancer. And I'm like, okay, that's a blessing. He says, but you do have, and then he went into details. He said, it's not an allergic reaction to Orencia. I don't believe you had double pneumonia. He said, I actually think that you have, and he goes into big details. And he goes, you have rheumatoid arthritis. He says, it is ILD. And I just looked at him. He said, do you understand what that is? And I said, yeah, I do. And our goal is to get you off the oxygen, get you back as best we can. He says, every 3 months, you're going to come see me. If you get sick, I don't care if it's sneezing, you wake up with a fever. He said, do not, I stress, do not go to urgent care. He said, I want you straight to the hospital, to the ER. And I looked at him and I said, what's my life expectancy? And he goes, I can't tell you that. Only God can tell you that. He said, but you've got to do things to help yourself. And I'm like, okay. So now I have to carry around a rescue inhaler. If there's anything I get close to that it's a smell that could actually trigger maybe, quote, an asthma attack, as he called it, I immediately will have to be at the ER. So I take water pills to pull the fluid off of my body. It was a shocker because everybody told me I had double pneumonia. Okay, that's understandable. I have bad allergies to the environment and stuff. And that's why I take Singular. No. They have found scar tissue in my lungs. And he said it could be from the hospital was treating me. But the funny thing was they brought in respiratory therapy and they made me do breathing treatments. I got worse. After I had a breathing treatment, I kept coughing me 3 times harder, couldn't breathe. And then they're like, oh, you're on a BiPAP, CPAP thing. And I said, yeah. And they're like, okay, you got sleep apnea. You need to bring that in. They had to run my oxygen and the water through it. This dummy puts it on, but he left it on high. I woke up, pulled everything off, the oxygen and the mask and everything. And I felt like I was drowning. And I called for the nurse and she said, what? And I'm like, I can't breathe. I can't breathe. So she disconnected everything and put it straight back on the oxygen and turned it up. She put me on 6 at the moment. And she came back in and she says, "Are you doing better?" And I'm like, "Yeah." And she said, "Here's your steroids." And I'm like, "No, no, I'm not taking nothing." And she's like, "Why?" I said, "I don't want to take anything." So when Dr. Crow came in the next morning, I told Dr. Crow what had happened. And he said, "We're taking you off the steroids." He said, "I think the steroids is making your lung diseases worse." So when I went to see the pulmonariologist, I showed him, I said, "Doc, I felt better after they took me off the steroids." And he goes, "Steroids is not going to help your lung disease." He said, you can't take that all the time." So meanwhile, I got no Orencia because they were trying to make sure that I didn't have a reaction. But that had kept me, the rheumatologist had kept me on leflutamide. And he told me, he says, "I don't want you taking anything unless you absolutely have to." He says, "Your heart medicines, yes, keep taking your heart medicines." And then he said, "Okay, we're going to start you back on your RA med and see if you do okay." The first dose of leflutamide I took, I couldn't breathe. I got short of breath again. And I looked at my husband, I said, "Maybe this was the problem all along." But what it was, the lung doctor was waiting for all the tests to come back. And he said, "Honey, it's not the leflutamide." He said, "But I would advise you not to take it no more if you do get short of breath like that." He said, "There could be something that's triggering it." And he basically told me, he said, "You grew up with smokers." He says, "But your rheumatoid is affecting your lungs." He says, "I'm going to be truthful with you." He said, "More likely you will one day go into respiratory failure, which will cause your heart to overwork because you have congestive heart failure already." He said, "And that's probably what's going to kill you." I said, "Okay, I understand." So you got to push. You can't take the first. If I took the first dose, and this is last year, it's been a week in the hospital. "Oh yeah, it's a double pneumonia. They gave me antibiotics and everything is fine." No, because my rheumatologist, "I'm going to keep you on 5 milligrams of steroids a day." And I'm like, "Nope," because that plays with my lungs. And she's, "Oh, now I noticed today I volunteer at the food bank 3 days a week. And I noticed today I got a little short of breath after I started sweeping the floor up there. But it's not real cold because we are in a warehouse and we do have air conditioning and I'm in the inside. I don't go outside and load the cars or anything. But I've noticed that I don't tolerate the humidity as well, like I used
Mhm.
to. Or if it's warm and I have to have it closed to breathe. My drinks, my husband knows that. He goes, "You used to drink water, room temperature." He goes, "You don't drink that now." He goes, "You have to have ice in it." He said, "You never used to drink your tea with ice." He said, "Now you have to have ice." And yeah, I have to have cold. I have a ceiling fan and an oscillating fan in my room for poor hubby. He has to wear a blanket at night sometimes. The house sits at 74.
Wow. That isn't like a very scary way to find out that you have ILD. Had it ever been on your radar before
See, they
that
told me it was pulmonary hypertension. That's what they always kept telling me. I years ago, I worked for a doctor, and this is when they first came out with. I didn't ever have health issues, even though I'm overweight and everything. I never had health issues until I went to work for this doctor, and they brought out the thin diet pills. And she looked at me and she's, "I ain't having a fat nurse. Here, start taking these. We're gonna let you." I did. I lost a lot amount of weight on them, but the minute I came off of them, the weight went back up. But meanwhile, nobody told us until after they took them off the market because of this. It caused heart problems. I have mitral valve
wow.
prolapse. I have the tricuspid prolapse, which causes the congestive heart failure because the heart has to pump harder now.
Yeah.
And for years, they would say, "Oh, you also have pulmonary hypertension because your blood counts and your counts are high when we do your heart caths and blah, blah, blah." When I went down for the CT scan and everything, that doctor looked at me and goes, "You don't have pulmonary hypertension. Who told you that?" And I said, "The heart doctors did in Florida." And he says, "No, you don't." And I said, "That's not what they're telling me." And
Wow.
I was treated for hypertension. And now I kind of find out I didn't have pulmonary hypertension.
Wow. That is it's very tough that when we hear these stories about people finding out about any type of disease related to AI arthritis disease, that it always has to come to us having found misdiagnoses
Mhm.
before, or being pushed aside. Oh, there's nothing wrong. It's just double pneumonia. We'll
Mhm.
have you treated for that. It's just, I think it has a lot to do with the awareness of obviously those practitioners that are trying to treat you at the first level. They just go with what they know. That's so hard.
And I know this from experience, and I know everybody that I've ever talked to. And being a nurse, I've heard it come out of people's mouths. Why does the doctor think because I'm fat that I'm unhealthy? Because I'm fat, that's, I even had one doctor one time tell me when I couldn't breathe real good, he's like, you're just having a panic attack. No, I know what panic attacks are, doc. I'm a nurse. And I don't pull the nurse card. I didn't, when I'd go into the hospital, I never said I was a nurse. I kept quiet because you get treated totally different.
Yeah.
This little community hospital here, I had been warned by many people here, don't ever go to that hospital. You don't want to go to that hospital. But we knew that I had this situation that needed to be taken care of. I
Yeah.
knew they had a helicopter. I knew they could flight me out if needed to be. And when I said to, and we hadn't been here but 6 months when this happened. And I said to my daughter, she came to visit, and she had this look on her face. And I said, what's wrong with you? She goes, Mom, you just don't look right. And I said, well, I got double pneumonia. Been really bad. I almost died. And she said, you're telling me that they were going to air carry you out to Charleston? I'm like, yeah. She said, Mom, that's over 3 hours away. She said, that's a major hospital. She said, it's like Orlando Hospital. She said, that's not good, Mom. She said, why are you still in this little community hospital? And I'm like, I feel better. They're getting me better. And she's, it's still, Mom. So now they tell my husband, I said, do I take the chance, go to a bigger hospital 20 miles away with my life at jeopardy? Do I go to the little community hospital and then they're going to have to air care me out now? And so now when I go to the emergency room for anything, I went in there because my RA acted up in the middle of the night, and my shoulder to my fingertips are swollen. My hand was double. And I'm like, nothing's working. I don't have any steroids at home. I can't do anything. And they're like, okay, we got you. I'm going to find out they give me 4 milligrams of steroids IV. And that's it. And I'm thinking, hey, dude, that ain't going to
That's
knock
not
it.
gonna work. Yeah.
And what it was, he was afraid to give me anything because he saw my chart and he read where I almost died a year ago. And he's supposed to go, no, we didn't go do this. We're afraid that. So now here's the big red flag that's okay. She's got this lung issue. Now we have to watch it, what we do for her. So yeah, it's shocking. It really is.
Yeah, and I think it all leads to, with you, with being a nurse, advocating for yourself does come second nature. I'm glad that you are able to do that because it's so hard for everybody to be able to do that. I'm always questioning myself, even though I've had my health issues since I was 8 years old. So I know a lot about what goes on
Yeah.
in my own body, but you still have that like questioning yourself versus the authority. And it's very hard.
I didn't get diagnosed until March of '08. I went to my primary and I'm like, look, I'm a nurse, and a couple of times my hands have just went boop and I've almost dropped a patient or almost got stuck by a needle because I'm doing this and all of a sudden my hands are going down. So she's, let's take a test, blood test. And she's, oh, wow, your set rate's really high. And I was like, 59.
Oh, wow.
Yeah. So I'm like, okay. Looking back now, I always complained about my joints hurting. My ankles would give out real easy and stuff. I probably had rheumatoid arthritis when I was younger and nobody knew it. And I asked my mother before she passed away, I was like, Mom, does anybody in your family have rheumatoid arthritis? No, nobody has it. It's emphysema because they're all smokers. And I'm like, okay. And I said to my dad, Dad, does your family side have it? No. Come to find out, yeah, Dad, it come from your side. One of my cousins one day was on Facebook and she was talking about her symptoms and how she had rheumatoid arthritis. And I'm like, that's me. That is me. But if I'd known this, maybe I could have gotten help sooner. You don't realize until, like you said, and then when, like I said, I've all my life I've had these doctors with the fat blinders on. Oh,
Yep.
this fat woman, your knees hurt because you're fat. Your elbow swells because you're fat. I've heard that. Oops, I've heard that plenty of times. So that's why I said you're like you said, if you can't advocate for yourself, it's scary. And me having a
Definitely.
nursing background really helps a lot because I'm like, hey, Can it be this or that? The rheumatologist and I have argued many a time. I'm taking you off these meds. And I'm like, no, you're not my cardiologist. You are not taking me off of this. You're not my pulmonologist. You're not my endocrinologist. That's not your specialty. You deal with what I've got with you, and that's it.
And that's the hard part about the healthcare system too, is that it's impossible to try to get all of these different specialists to speak with
Mhm.
each other, work as a team, to treat one patient. It is almost close to impossible for them to even look at each other's notes sometimes.
The way the system is up here, now I do like South Carolina system to a degree. This little community town I'm in, they're in a big association called MUSC, which is the Medical University of South Carolina. That's all connected. So if you go to one of their satellite offices, the big corporate hears, everybody hears it. Then in Rock Hill, which is 20 miles away, is Piedmont medical stuff. Okay, so that is why my specialists are all, because there's nobody here
Yeah.
unless I get somebody comes in and I visit them when they come into town. So I go to over there, and that's where most of my specialists are, and they all have the connection where you can click in one spot and you got anybody's records. They send me to the local hospital over there to get blood work and x-rays and all that. They all can pull it up. But it's like you said, nobody wants to talk to nobody. It's okay, so yeah, that's my patient. I think the biggest shock for my rheumatoid arthritis doctor is I'm currently now on 21 meds still per month.
Oh my
When
goodness.
I saw her, I was on 24 meds a month. And she's, oh, no, that's just too much. And I'm like, you take me off. You want to take me off the R? I saw her a month ago. She says, I just don't understand how you could be off of the Orencia and the steroids and not have any issues. Now you're flaring, you're hurting more. And I'm like, looking at her like, really? You have the audacity to say that to me? Okay, I was taking leflutamide, not knowing that was contributing to my lung issues. I take the Orencia injectables. I might as well take a shot of salt water because they really don't work. I just don't understand it. Lady, I'm about to
You're
die.
yeah, I know, like, why are you telling me this?
I'm
That
about
is
to die.
not giving me any confidence.
I dropped 70 pounds in a month. That's how bad it was. I was dragging oxygen tanks with me everywhere I went. I was dragging oxygen. And the insurance is, we're going to pay for this. And if you have to have this concentrator forever, blah, blah, blah. And I'm like, no, lung doctors tell me to wean myself off the oxygen if I can. I've got to come off of it because once I become dependent, I'm not going to come off of it. You have to work at it. I was doing everything he told me to do and stuff. And it was like, there'd be days I'd be sitting here and all of a sudden I'm like, oh, I can't breathe. I can't breathe. My husband's, what's wrong? And I'm like, don't you smell it? He's, what is the smell? What's the smell you smell? And I'm like, I smell smoke. And he's, hold on. He'd go grab the oxygen, bring it to me. And he's, nobody smokes. There's no candles lit, no nothing in the house. Don't understand. And I'm like, I just smell it. And he's, okay. Or we could go out to eat, or we go grocery shopping. I'd be wearing my mask, and somebody would walk by me with real heavy perfume. And I'm wearing the oxygen now because I'm on it for 24 hours a day, nonstop. And we were in Walmart, him and me and my daughter. And I had my mask on and I had the oxygen on. And we walked and started to walk out of the air. And I got real lightheaded and I just started going down. So I was like, okay, I'm gonna sit on the floor. And I went down to the floor. And my husband and her were freaking out. They're like, what's wrong? And I'm shaking my head. I can't talk to you guys. I can't breathe. I can't
Yeah.
breathe. And he's like, Cyndi, do I need to call an ambulance? And I'm like, and he's, you're really pale. And I'm, well, I'm already pale, but he's, you're pale. And I'm like, I'm okay now. I can breathe. I can feel it. He goes, what happened? I said, somebody had really heavy cologne and walked by me. And I
Wow.
said, I got where I couldn't breathe. And he goes, but you got your mask on. I said, yeah, it got worse. He got up underneath the mask and he's, oh. And so I'm asking the doctors, everybody, should I get the vaccines? Do I need the COVID vaccines? Do I need the pneumonias? Will it do any good because I am immune suppressed because of RA?
Yeah.
And they're like, yeah, it's better that you get them than not to get them. And the funny thing was, and I kept telling them this, when I went into the hospital with my double pneumonia, when I went into the urgent care, was coughing with the high fever, They shoved Q-tips up my nose. They shoved Q-tips in my throat. Oh, no, you don't have strep. No, you don't have RSV. You do not have COVID. I said, okay. When I was in the hospital, every day they were coming and testing me for the same thing. And I'm like, I don't have this stuff. I'm real cautious. This is double pneumonia, is what you're all telling me. Chest x-rays show you this double pneumonia. Why are you all doing this to me? I even had them come in and test me for MRSA.
Wow.
And I'm like, okay, that's when I pulled the nurse card then. I got aggravated. That and my IVs were blowing and they weren't listening to me where I told them to put the IVs. So I got a little aggravated and I said, that's it. And I said, all right, let me tell you something. I'm a retired nurse. You're not sticking me here this again. You're not doing this. This is where you're going to put my IV. And the one nurse got a little snarky with me and he goes, I'm going to put it here. And I said, no, you're not. I have a rheumatoid arthritis nodule that you can see right here. See it?
Mm-hmm.
You can't put an IV there. They were trying to put IVs there. I said, you're going to get a rheumatoid nodule. It ain't going to go nowhere. You're going to not get nothing. You're going to stick me on stuff. And they're like, oh, okay. And I'm like, that respiratory therapist that tried to kill me last night, you can get back out of my room. Somebody else in here. And the doctor came in, Dr. Kearney, before he got ready to discharge me, he goes, you're a retired nurse? I said, yes, sir. He said, why didn't you tell us from the beginning? I said, so you could treat me different? I said, I wanted to see how you guys would do me. How would you treat me? And the lung doctor, I told him straight up, I said, I'm going to tell you right now, I'm a retired nurse. Don't pull punches. Tell me like it is. The cardiologist, I tell him the same thing. I'm a retired nurse. Tell me straight like it is. But the rheumatologist, it's, okay. And I said, the lung doctor's asked me to ask you when I can start the Orencia. That's his decision. No, it's your decision. You have this lung disease. We can't take a chance. He's telling you that I can start it. When are you going to restart me back on the IV on Orencia? Because they pulled me off of it for so long, my insurance decided to change their tunes. Now they no longer will cover IVs. So that's how come I'm on the injectables. Yeah. So it's, do I take anything or don't take anything? I know.
It's so frustrating. And it's not even just with the actual doctors and the medical system, but then there's that added layer in our country of the insurances and all
Yeah,
of those things. And
yeah,
it's as if we don't have enough things to worry about as AI arthritis patients in general. We have to worry about where we might be getting the money to pay for our
yeah,
treatment as well. And it's
yeah.
ridiculous.
It is. It is ridiculous.
Yeah.
Yeah. I had the insurance. I have a case manager with the insurance. And I flat just told her, she's an RN. I flat told her, I said, look, I'm a retired nurse. I said, but I'm going to let you do your job. And here's what I need. And she says, it's great that you're a nurse, that you know pretty well what you need. And I said, do you know how scary it is to be told you sit in the hospital for a week and the doctor comes in and tells you, you almost died on us? We almost carried you out because you're so bad. And it's not just because of one, it's a combination of everything. And it's like, now I have to live with this lung disease. Yes, I knew I had asthma, supposedly, but now all these years I was told pulmonary hypertension, and it wasn't. It was lung disease from my rheumatoid arthritis that nobody was smart enough to put two and two together.
Yeah. Oh man, that is a really tough story to hear. How are you doing right now with your ILD?
Like I said, today I had an episode of where I was just, it was fine. I was not sweating. I wasn't hot. I got up from the chair. I run the computers at the food bank, is what it is. I don't have to do anything physical because they know my limitations. I won't overdo it. So I sit at the computer and I type in the patient. I call them patients, but they're clients. I take and put the client's information in and ask them questions, all that. But I have a little room that's probably, I'd say 10 by 10. So I always sweep it every Monday, Wednesday, Friday, because I'm just that kind of person. I don't want to leave my office area dirty. So I got up. My husband comes in. He stopped in to see me on his way to work, and he's listening. I'm like, okay. And he says, hey, don't overdo it today. And I was like, I'm not. I'm going home and watch TV with the dogs. And I got that meeting at 5 to 6. And I said, I'm not going to overdo anything. He goes, okay. Because he's real protective over me. So I picked up the broom and I started sweeping. And he's, oh, by the way, he goes, you forgot to give me a kiss. And I said, okay. So I went to give him a kiss and I just stood there and looked at him and he goes, you okay? And I'm like, shook my head a little bit. And he goes, a little short of breath, aren't you? And I went, so he stood there with me and he goes, okay. He says, you feeling better? And I said, yeah. He goes, I know you are now. And I said, how did you know? And he goes, your lips not as purple. It's not as pale. And I
Wow.
said, I just got real short of breath, Tony. And he goes, yeah. I said, I could tell by the way you looked that something wasn't right. And he said, all you did was stand up and picked up he goes, you reached over and grabbed the broom where you had it. He said, you didn't do anything. And then you went, oh, let me kiss you goodbye. He said, and he said, he goes, I worry about you. And I was like, I know. So that's why he was calling, just checking on me. Okay,
Yeah.
you're fine. But he asked the pulmonologist, he said, why can't we keep the oxygen at home for her? So from June to October of last year, I was on oxygen. That's how long it took to get me off of it. And he's, can we not keep it there just in case we need it? And that's when he told him, he said, if she needs oxygen, she's getting that bad. He goes, I want you to call an ambulance, get her in the hospital. He said, we can't play with her. He said, we can't take that chance. He said, if she goes into respiratory therapy, he says, with her putting on oxygen and she's trying to keep a respiratory failure, he said, it's not going to work. He said, we need to get her the medical treatment. He's okay.
That makes sense.
Yeah.
And what is your treatment plan for the ILD specifically? So the rescue inhaler.
I did, yeah, I have an albuterol rescue inhaler now. And now I have a nebulizer that I have to do breathing treatments if it starts that I feel like I'm starting to get short of breath more often. I have to wear a mask every time I go outside now, which does not help. You can't breathe. It's really bad to wear a mask. You know that. During COVID, we all had our problems. That was one of the things about being a nurse. You have to be able to wear a mask when you're treating TB patients and all that. And so I do that. And then I have to stay away from people that they start coughing. If you and I were face to face and you're coughing, I'd be like,
Would not
okay,
work.
we're not going to work. This is not going to work. I pretty well stay home a lot. I don't go out a lot. COVID is on the increase up here again. Yeah. And then I work the food bank. Yeah, that's not real cool. But I have a fan that sits behind me and it blows the air away from me because I told him, I said, we got to keep the germs. I have hand sanitizer like crazy. I wear gloves up there. I don't touch anything. But the worst part is now I have to take water pills every day
Mm.
to make sure there's no fluid building up on the lungs. It's like I said, it's really different.
Yes, definitely. And just with our last question, anything in specific that you would want other AI arthritis patients to know about ILD or any like giving them a heads up or what to look out for or anything like that?
If you think you have a common cold or anything, you need to go see your doctor. Don't wait. You saw that this happened on a Saturday, a double ear infection, and by Wednesday evening it was getting worse, and by Friday I was on death's door. That's how fast it happened. Not even a week span. So yeah, you can't play. You've got to get taken care of. Even if you think, oh, I've had this symptoms before. Oh, it's just a common cold. It's allergies. No, don't take that chance. It's better to be on the safer side than the sorry side.
Absolutely.
You know, if I hadn't passed out, I don't know how long I would have kept on going. I was coughing, could catch my breath. And now it's just I said, and the take is the time, and I can tell you, it's June the 14th, June the 20th was of last year is when I was sitting in the hospital. So when
Wow.
June the 14th came up, it was like I'm really super cautious to make sure anything prior, I'm not doing this, I'm not doing that. My husband's that's I said, yeah, it's scary to think the next morning the doctor comes in, sits down, holds your hand, says, honey, you most died on us. If you hadn't turned around, we were going to air carry you out. I used to work in the ER too. So I know what it was like to air care people's family members out.
Yeah.
A lot of times they didn't make it. You know, Orlando was a big trauma center, and I worked in a little community hospital like this, and then we air care them out because we were connected. So yes, anytime you get any kind of symptom, even if you think it's just like I said, the common cold, please go get checked out. You never
Absolutely.
know.
Yeah, it's very hard because then again, we have to think about, oh, what's the cost? It sucks that it's in the back of our mind. What's the cost for us to go to this ER or
Yeah.
Do we go to the urgent care versus the ER? What is the right thing to do?
Glad you said that. Like I said, in December, I went to the ER. It was 12:45 at night. I was in severe pain. I could not sleep. Nothing I had. I do have Ultram. I have what's just tramadols. They're not strong enough. They don't touch the pain. I didn't want anything for pain. I just wanted you to give me some steroids IV, watch me for a while to make sure I didn't have a severe reaction because of my lungs, and then let me go home. And then I'd be fine and call the rheumatologist next morning. But that's just not what happened. It was a long 4 hours of my life, which was fine. But the kicker was, I didn't know this. The doctor had told the nurses to give me something for pain. And the nurse said, we're going to give you something for pain. And I said, okay. I said, I don't need nothing strong, just enough to, if you take the swelling down, I'll be okay. That's where all the pain was. They gave me morphine, IV. Morphine will decrease your breathing. And then they had to come in and they put oxygen on me because my oxygen level, according to the heart monitor they had on me, showing what my heart was doing, showed my oxygen level and it started dropping. So it's here we go. You give me a pain medication. You almost decreased my oxygen levels and didn't let me know that's what you gave me. I didn't know it until I went to my primary. And I pulled the records up and he pulled the records up. He goes, why'd you take morphine? And I'm like, what? No, I told him no pain medicine. He said, yeah, they gave you morphine. And that's how I found out I got 4 milligrams of steroids. And I said, 4 milligrams wasn't going to knock that. If I had that at home, I would have took that. Now I would have knocked, no, that ain't going to knock it. But I got a letter from insurance and I've been getting them every month now telling me it's cheaper to go to urgent care than to the ER. They want me to go to urgent care. And I'm like, you're crazy. That's PAs.
Yeah,
That's
literally what they.
Yeah, there's no doctor. Because the ER doctor even said that to me. He goes, don't ever go back to urgent care. He goes, there's no doctors. He said, those are physician's assistants. He said, I got a degree a little bit more than you do. He said, do not go back. He said, no. Yeah, but insurance is now saying it's cheaper for you to urgent care. I'm like, really? Yeah.
Yeah, it's a hard thing to have to balance because it's every time for us, because there's such high stakes, we should be going to the ER to get the full workup and all those things, like you said.
Yeah.
And unfortunately, depending on what insurance you have, that can be up to $250 just for one visit. And it's tough.
Oh, yeah. The Orencia shots, my out of pocket, are $1,700 with insurance. I'm on Medicare Part A. I docked the Part B when I got the disability and went on my husband's work insurance because it was covering more. So when I got the bill for $1,700 for the shots, I called them up and I'm like, hey, no, I can't afford this. So then they did some copay assistance through the pharmaceutical company. And they said, okay, it only costs you $200 a month. And I'm like, that's not in my budget either. So then the specialty insurance, the specialty pharmacy calls me and goes, if you will go through Prudence RX, you don't have no copay. So I'm like, oh, so now I don't have no copays. They cleared it. But meanwhile, I had to get the case manager for insurance involved to say, hey, look, I can't afford this. I even told the rheumatologist, I can't afford this. And I told my husband, I said, they don't realize they're playing with my health. If I don't keep the RA under control, what will it do to my lungs even more? You know, I have scars. I was shocked when he told me there's scars on me. And I went, wow. And I asked him, I said, did I have double pneumonia? And he said, no. He said, you had pneumothoracitis. He said, you never had double pneumonia. I said, then why was I given Rocephin, vancomycin, and all that? He said, because they were trying to treat everything they could think of that do my beat. He said, that's what they were doing. He said, they had to do something. He said, you were crashing. I'm like, yeah, 94 over 49. Yeah, that's crashing. That's IV crashing.
Absolutely.
Because your kidneys were going into failure because everything was going down. So now I'm like, if I get a cough, I'm going to the ER. or I'm going to the primary and say, okay, now you refer me to the ER because you can't do anything. That's like the other day I went to him over for 2 weeks now. I said, hey, I've got this little spot on my neck. I think it's a rheumatoid nodule. Took pictures. He said, no, it's a cyst. I said, okay. So I said, doc, and I showed up at his office. And I said, can I see the doctor? And they're like, yeah. What called? And they're like, what do you need? I said, look at this thing growing. I need some help with it. And they're like, what do you mean? I said, I'm really concerned. And they're like, we can do what we can. Let's see. And I showed it to this girl. I don't know if you can see this on the back of my neck here or not.
Oh, wow.
That's what grew on my neck.
Oh, wow.
And them telling me, oh, yeah, it's just a cyst. Cysts don't turn purple and red like that.
No.
So I go to see him. He's, oh, you need to go see a surgeon. And I'm like, what? He's, yeah, we need to send you to a surgeon. That probably needs to be removed. I can't be put to sleep, doc. I have lung issues. I can't even have, I even said to him, what happens if my gallbladder goes bad? I can't have emergency surgeries now because I have lung issues. He said, yeah, they can deal with it now that they know about it. I don't know if the lung doctor's going to agree to me having surgery and put under anesthesia. And he's, if it comes down to emergency, they'll do that. So then he's sending me to a surgeon over that. I'm like, okay, yeah, I've had a cyst removed in the office before. So they don't put you to sleep. They numb the crap out of you and cut it out and you're done and over with. So he put me on antibiotics and it's gone way, way completely down and stuff. So hopefully he don't have to do anything. I see him Friday. But there's that factor too. Now I can't
Go under general anesthesia.
Can't go under general anesthesia. And now I'm even afraid to go back to the dentist. What will the Novocaine do? What would the Novocaine do to me? And if they can't do Novocaine, I can't do laughing gas. My lungs are so bad now. So yeah, it's been a big life changer. Very big life changer. Do I live life to the fullest? Oh yeah. Because now I don't know. I just turned 60, June 11th. I don't know when my days are counted.
Wow. So your incident that you had that happened when you were in the hospital happened right after your birthday as well.
Yeah. Yes.
Wow.
So yeah. My mother was 50 years old when she died of a massive MI. She had a massive heart attack and died. I have a young sister. She's only 3 years younger than me, but she's a heavy smoker, like our dad. And she drank heavily. She has 5 stents in her because she's had 3 of the Widowmaker heart attacks from her
Wow.
smoking. Yeah, from her smoking and drinking. She's quit, but now she's on hospice care and she's on oxygen 24/7. So, it's stuff to think about. She's only
Definitely.
57. Yeah, and I'm 60. And then I've got told that my lungs they got scars on them. They're going to get worse to the point that it will cause me one day to go into respiratory failure, have a massive heart attack, and die. And it's all because I have RA.
And you didn't know that you had RA for a very long time. So it could
Yeah.
have been already affecting all of these different
Yeah.
organs and things like that before you even knew it. You said that was 2008. So
Yeah.
you were in your 40s when
Yeah.
you were diagnosed?
Mm-hmm.
Wow.
Yes.
So you could have gone 30
Well, looking back,
years maybe even.
yeah. Looking back when I was 15 and would say, God, my knees hurt, my hips hurt so bad. And when I go sit in the hottest water, I'd come out with my skin bright red, sitting in a bathtub with my knees and my hips in the hottest water I could stand. And their mom saying, oh, it's growing pains. Oh, it's because you're overweight and all this. Now looking back, no, it could have been rheumatoid arthritis, but nobody knew.
Wow.
And nobody knew. And okay, here we go.
Thank you
So here,
so much for telling your story today, Cyndi. I'm so glad that you're here to tell the story and to be able to help us with elevating this cause, because just from hearing your story, I feel so much even more energized to try to be able to let people know that they need to look out for this and know the symptoms and signs to get it diagnosed early so that they can prevent all of those things from happening.
yeah. I did it took me 2 months to wean myself off the oxygen. And the pulmonologist was ecstatic. He said, you coming off the oxygen is a big, big factor for you. He said, that's great. He said, because if you stay on it, he said, then a lot of times you don't come off. And he said, that's the problem. because the lungs get so tired from working. And I'm like, oh no, I did everything. I did the breathing exercises. I did the nebulizer. I did everything you told me to, doc. I was coming off oxygen. I was tired of dragging that tank around. You know,
Yep.
and it running out of oxygen. Your tank's supposed to last a certain amount of hours and didn't. So I was always carrying around extra tanks. But yes, if this helps one person to think, okay, I got a cold, I'm gonna go to the doctor, make sure, and push. Don't take the first diagnosis they tell you.
Absolutely.
Yeah.
And that's with our diseases, and that's with everybody who wants to be able to know what's going on with their body. Always ask questions. Do not just accept the first thing that they tell you, and always go with your gut.
Oh,
Your
yeah.
body more than anybody else does.
That's right. So I'm living life to the fullest. I'll keep working at the food bank until golly knows when he says, hey, time to go home.
Yeah. Thank you so
Thank
much
you.
again, Cyndi. And I had so much fun listening to your story today. I know it's not fun, but I love being able to connect with patients and just fully
Yes.
understanding everybody's story, because there's so much everybody can learn from every single person's story when it comes to these diseases.
And I love the one about the spoons. And I even said that to one of my aunts that she just got over having breast cancer. And she said, I'm so tired. And I said, count it out. You've got 12 spoons for the day. This spoon takes this and this one takes a spoon. And she looked at me and I go, when you're out of spoons, tell them, too bad. I'm out of spoons for the day. Can't do any more. She said, I never thought about that. I said, that's how I do it. That's how I do it. And like I said, now yesterday I didn't work at the food bank. I made 20 breakfast burritos, sausage and bacon. I made chocolate chip cookies and stuff. But I did a lot of stuff sitting down too because I don't try to wear myself out. And
Mhm.
my husband, that's what I'm talking about. Don't overdo it. And stuff. It was
Definitely.
nice talking to you.
It
And if
was
there's
so
any
nice.
anytime, because we're all right girls.
Yep.
We know.
That's definitely. Thank you so much. Like one other thing, if you can send me a headshot, that would
Uh-huh.
be amazing. You could just email it to
I got a
me or
good one with
however.
makeup and my hair. Yeah, my hair.
Yes.
Because you see it's hot and sweaty up here, so I'm like, yeah.
Yes, so
I'm just
that
like,
would be
yeah.
great. And I'll be doing some audiograms from this interview, basically just pulling 90-second clips to be able
Sure,
to
you pull.
do it all over social media and things like that. And I'll definitely let you know once
That's
everything
fine.
comes out. Probably not going to be finalized for the next 2 to 3 months, but you're my first interview. So I'm looking for two more. So I'm going to be going out and doing all of those. So I will keep you updated on the progress of the project.
Okay. I was actually in a test study years ago, and I was one of the test studies for the Rinsea injectables to come out into the market.
Oh, wow.
Yeah.
That's awesome.
Uh, And I did so good on it, they kept me on it longer, me and the other lady at the office.
Mhm.
And it was really amazing how well I felt and everything. And so, yeah.
Nowadays, I'm like, hopefully, I knew you said sometimes it doesn't help you as much nowadays, but
No, because
um,
I'm immune. I think I've gotten immune to it too. And
yeah,
see, I was on Xeljanz. I did great on Xeljanz, but of course, the black box warnings came out about heart people. Guess who got pulled off because of that? Yeah, it sucks. It really does. And I'm
definitely.
limited. Insurance won't cover a lot of stuff now.
Especially with Medicare and things like that, it's just very tough.
That's why I got rid of my Medicare. I kept the hospitalization, but I'm on Blue Cross and Blue Shield through hubby's work.
That's good.
And yeah, and it covers everything.